Hello everyone, welcome back to Self-Help Acupressure. Today we will discuss low backache or lumbago and how to handle the problem with acupressure. Low back pain is a widespread problem. About 80% of the adult population experience low back pain at some point in their lifetime. In most cases, people develop back pain due to muscle strain after doing something strenuous, such as lifting a heavy box, weightlifting, or making a quick twisting or jerking motion involving the back. A person may experience a sharp pain that causes a burning or tingling sensation or a radiating ache. They may also feel that they have a stiff back, aching muscles, and pain that gets worse if they twist or move the back. Now, many different muscles, bones, and connective tissue meet in the back, and any one of them may be associated with some sort of trauma. Signs of serious injury in the back can include loss of bladder control, numbness anywhere in the lower half of the body, weakness in the legs, pain while coughing or while urinating. Such patients should be further investigated before attempting acupressure. For disorders that fall under lumbago, sacroiliac strain, disc degeneration, spondylitis, and sciatica, and don't require surgical intervention, one can try acupressure. Remember to add cold and hot compresses in the acute phase and to avoid exercises involving spinal flexion. Points on any meridian crossing a particular affected area of the body are chosen for acupuncture or acupressure. For low backache and sciatica, we have three important meridians that traverse this area. The governing vessel or brain meridian traverses the midline, and the split urinary bladder meridian covers a wide area on either side of the midline in the back. Points on both are effective for back problems. The gallbladder traverses the sides of the waist and gluteal region. This is particularly effective for sciatic pain. Now let's locate the local points first. Understanding the location of these points on these channels is important for correct therapy. A line joining the iliac crest crosses the tip of the fourth lumbar spine, and the gap between the fourth and fifth spine is the important GV3 point of the governing vessel or brain channel. Another point on the governing vessel is the GV4 point, which lies in between the vertebral spine of the lumbar second and lumbar third vertebra. This can be reached by counting the spine from the L4 spine upwards. On either side of the GV4 point, 2 finger breadths lateral on both sides is the UB23 point, and 4 finger breadths on either side is the UB52 point. Pressure on all these 5 points can be done with the help of an assistant or buddy. And pressure should be applied for at least 10 seconds each. Now for self-therapy, place your hands on the hips and your thumbs horizontally towards the midline. The point where they meet is the point GV3, and it is located below the level of the spine of the fourth vertebra. Pressure here with the thumb will be pressing the GV3 point. Your hands below the rib cage and bring your thumbs horizontally together to meet in the midline. The point where they meet is the GB4 point and is located below the spine of the lumbar second vertebra. Pressure between the second and third vertebra is required to be done to stimulate this point. The simple eraser for low back fatigue is now to simply insert your fists and knuckles into the back on either side of the lumbar vertebra. By this, the points on the urinary bladder channel on either side of the midline get stimulated. This is how the urinary bladder channel is being stimulated with the help of the knuckles. After stimulating the local points, one is required to stimulate distal points. Distal points are points on these meridians which are located away from the affected area. Pressure on these points contribute to the effectiveness of the acupressure therapy. These are located over the center of the gluteal fold, that is bladder 36, center of the popliteal fossa behind the knee, that is bladder 40, and at the ankle between the tip of the lateral malleolus and the lateral border of the tendoachilles tendon. This is bladder 60. Any disorder involving bones, muscles and tendons should include the gallbladder 34 point. This is located on the lateral aspect of the knee in front of the neck of the fibula. This is the influential point for the bones, tendons and muscles. This is GB34. It is located in front of the neck of the fibula at this location. Pressure should be applied for at least 10 seconds for stimulation. Other points that are useful for symptomatic pain relief are large intestine 4, stomach 44 and reflex points on the heel. These have been described earlier. For those having associated sciatica pain, one needs to apply pressure over the gallbladder 30 and 31 points. To locate gallbladder 30, draw an imaginary line joining the sacral hiatus to the greater trochanter of the femur. The point on the medial 2/3 and lateral 1/3 on this line is GB30. Located on an imaginary line from the greater trochanter to the sacral hiatus, on its lateral 1/3 and medial 2/3 is the GB30 point. It is a very important point for treating sciatic pain. GB31 point can be located on the lateral aspect of the thigh at the tip of the middle finger when the hand is kept on the side of the thigh. On standing with an outstretched hand, the tip of the middle finger lies the gallbladder 31 point. This is also a very important point for treating sciatic pain. Lastly, there are 3 ear points located in front of the pinna, namely the Shenmen, low back area and sciatic nerve. Pressure over the antihelix will stimulate these 3 areas and help in pain relief in those having lumbago and sciatica. Ear acupressure for low back involves pressing the antihelix area here and here for about 10 seconds. This should be done on both ears.